that was not intentioned in the bill. Several members of Congress have spoken out against this courageously. So if it's good enough, if these exchanges and the rates that they're charging are good enough for the rest of us, that it should be good enough for members of Congress and their staff. And they were all talking about it, Jeff. This was common knowledge on the Hill. Oh golly, do not implement this bill. And they were begging Obama to come up with some workaround and solution. It's nice to know that they were able to have that access to the administration, because most working families don't have that level of access to get a special exemption.
Yeah, so Congress is subsidizing their health care, as many businesses do. But the question really isn't that. The question is, Obamacare does do some positive things in spite of having a number of flaws. It for the first time insures a lot of people who were not insured before. My own daughter, prior to her getting a job with benefits, was in a category where she just couldn't get health insurance. And with Obamacare in place, she could. But the problem is the way there is so much polarization in Congress right now that the House basically is saying we're not going to vote for anything except total repeal. And that's not going to happen in the Senate. So how do you make reasonable changes in the law that are productive in that kind of environment?
First and foremost, you can't just say repeal and replace. People want to know what is the solution to the healthcare crisis. Our healthcare system is broken when you have millions of Americans who don't have access to health insurance. My mom had pretty cruddy health insurance, and as a result, in part due to that, she got misdiagnosed, and her cancer went undetected for 2 years. It cost her her life. And I saw the healthcare system fail her. She had insurance. Can you imagine someone not having insurance? So the first and most important element that we've got to say we have to ensure is that we need to have health care reform that expands affordability and accessibility. The President's decision to provide more government intervention and regulation in the healthcare system is going to increase the cost of healthcare. When you look at all the studies that are out there, you see time and time again, the costs are going up. Now there are some good things that I think that we should keep. Pre-existing conditions. Someone should not be penalized. For students living with their parents, people who are above the age of 18, why not let them, if it works out for them, why not let them continue to buy and receive coverage from their parents? So there are some things that I think that we can use to expand accessibility that were part of that bill. But the vast majority of ideas there have been proven unworkable, bureaucratic, and costly. For example, Obama decided to exempt millionaires, the 1%, by telling employers, we're going to push back the employer mandate. So employers do not have to provide you with health insurance. They got an exemption. There's a lot of exemptions that are starting to rack up on this bill. But then Obama turned and said, and Congress did as well, Mr. Peters said as well, individual working families will not get an exemption. If you don't have health insurance on the date this goes into effect, you will either pay a higher tax, a penalty, or you'll be forced to do a government-run health program. So the millionaires get the exemption, the employers. The working bloke, no, you're stuck. That's a broken system. And so what I think we need to do is say, are there good things we need to keep? Yes. Are there better ideas to cut costs, to expand accessibility? Can we speed up the approval of medical innovation so that we can get better healthcare treatments that cut costs? Can we embrace technology so that there's more accessibility and easier access to healthcare professionals? Can we cut the regulation and red tape? What costs money? Are there lawsuits that are driving up the cost of healthcare because doctors are no longer practicing the right medicine, but defensive medicine? I'll tell you a real quick story, just as an example of this healthcare system. A couple months after the mayor's election, I started feeling pain in my right arm, my elbow. It came to be about February, early February, where the pain was so bad I could not lift the cell phone off my nightstand in the morning. That much pain. Could not lift the cell phone. I'd be at Costco or Walmart and someone would come up and give me a shake and I would almost cry in pain. So I go into the doctor, thinking I must have injured something, lifting weights or whatnot. And he said, oh, I think I know what you have. He isolated a muscle right here with his finger. He said, lift. I was like, oh, wow, this is great. He said, now try it. Oh, wow, this hurts. He said, you have politician arm. And he said, how many events would you go to in a day back in October, November, and September? And I said, well, probably 10, 15 events, and probably met 50 people per event and shook everyone's hand. He said, well, your muscle developed repetitive motion. And then once you stopped going to those events, your muscle contracted, and that's where your pain is. So he gave me a $5 brace, one of those little elastic braces. He prescribed about 2 weeks worth of pain medicine. He gave me a prescription as to what muscle exercise I was supposed to do with the roll of quarters. And then he said, I'm going to order an x-ray, because on the off chance that you have a tumor in your elbow, we need to know. And I said, well, I'm under a health savings account. I'm paying out of pocket up to a certain deductible. I think my deductible is like $4,000. I don't believe I need an x-ray. I'm going to try your treatment for about 2 to 3 weeks. If it doesn't get better, I'm going to come back because there may be a tumor in my arm. Now, ordinarily, the government-run healthcare system, or Medicare, or my health insurance, if I was under a PPO, Preferred Provider Organization, or even HMO, would have paid for that. Because why? If they don't do the x-ray and I suddenly have a tumor, they get sued. He knows this is not necessary. And because I have a health savings account, I say, I'm going to sign your waiver. I don't want to do the x-ray. If I still hurt in a couple of weeks, I'll come back and I'll pay the $300, $400 it will cost for an x-ray. I'm perfectly better. I decided to run for office because I needed to shake more arms. More hands. But this is just an example of our healthcare system where we need to really think about how do we vest the decision between patients and their medical professionals. You get the bureaucracy out of the way, provide the incentives, the environment where people can get access to health insurance. There is no perfect answer, but I can tell you right now, what we have on the books, because of all these waivers, isn't workable. We got to come up with a better solution, and there's no Democrat or Republican way to do it. We got to come up with a good way. Thank you.